Hi, I'm Robin DeWind. Going to the dentist is never easy, but we want to make sure you get that beautiful smile you've always dreamed of, show you how you can eat your favorite foods once again, and have the confidence to get help for that nagging pain you may be putting off. Progressive Implantology and Periodontics is here to help. If you've been told you have gum disease, need surgery, or have missing teeth, Progressive Implantology and Periodontics is here to help. Their team has the latest technology to treat your dental issue comfortably. Coming up, we're going to show you how laser gum surgery, treatment for gum recession, and dental implants can make all the difference in your smile and overall health. But first, let's get to know the team at Progressive and hear what their patients have to say.
Most of the folks we see are people that have had some history of dentistry. So a lot of our patients have had a history of root canals, or maybe they're missing some teeth, or they have a history of gum disease. They're in a situation where they know, look, my problems are a little bit complex. I'm not eating and chewing and functioning or smiling or interacting socially the way I want to be. I need to do something that's going to set me up for the long term.
He took more interest in my teeth than any dentist ever did. As you can tell, he loves his toys. And he has all the good stuff, and anything that comes along that he thinks he can use, he uses it. And he uses it on his patients, and it helps.
I like saving teeth, and that's a lot of what we try to do, is basically take teeth that other dentists may look at and say, I don't think we can count on this. And if we can save it for a substantial period of time, that makes me feel good, that makes the patient feel good, they're able to function and be healthier.
Today's society, we want things done very quickly. The problem is that when you rush through treatment, sometimes you're creating more issues down the road. So when we meet patients for the first time, we take a moment and we say, look, these are the different things that are happening. We're going to tackle all of them. We're going to get you to where you want to go. Let's focus on this part first.
It's necessary for us to go, but usually not the most pleasant experience. We're thinking of pain, uncomfortable, usually something that we don't look forward to going, and find ways of maybe rescheduling or canceling, as I have on occasion.
One of the first things that patients are worried about when they first come to Progressive is, why am I coming to Progressive? Patients always think that whatever's happening in their mouth is much, much, much worse than it really is, because it's the unknown. One of the greatest parts of our job is once we do an assessment and we find out where patients are, letting them know in the vast majority of cases that things aren't that dire. Quite frankly, there's a lot here that we can work with.
Progressive Implantology and Periodontics offers 5 convenient locations around the Rochester area. They don't want distance or cost to be a barrier. Financial plans are also available. Each office has the same technology, and your doctor will come to you. So every patient has the same experience, no matter where they're being treated.
Progressive is very conscientious, very reputable. If they'll tell you what you need, and then if you ask for it, they will give you a price and they will stand by it.
From the moment you walk in the door, the professionalism of the receptionists to when you're actually getting the work done is second to none.
This is a judgment-free zone. Folks have some difficult situations. That's why we're here. Our job is to figure out what happened, what can we do for you, and let's get you to that solution. And we all share in the excitement the patients have for their outcome and for their new smile. When someone comes in that we haven't seen since their general dentist restored their teeth. So we did some implants, or we got them all set for some great veneers, and they go back and they see their dentist. When they walk in the door and we haven't seen their smile yet, it goes through the office. There's a buzz. It's like, did you see his veneers? They look incredible. One of the most amazing things that we get to do here is at Progressive Implantology is we get to create smiles that not only look beautiful in conjunction with your dentist, but we also get to enable you to go out and enjoy your friends again, to enjoy life again, to go to that restaurant where you can have your favorite food, or you can have that great steak, or whatever the case might be.
The team at Progressive also wants to give you back your overall health. They believe that a healthy body starts with a healthy mouth.
And that's one of the messages at Progressive Implantology and Periodontics, is that, you know, our mouth is connected to our body. The same blood vessels that go through our gums feed back into the heart. So if our gums are diseased, it's flowing through the rest of our body.
Some of the research I did when I was in periodontal residency was that the bacteria that we find in the gums is the same bacteria that can be found in the heart vessels. And so if we can manage that infection component, that's something that can help us systemically.
Periodontal disease is linked to so many different ailments and diseases, as far as high blood pressure, different types of cancers. It's really truly incredible, the oral systemic link and how involved that is. In having an unhealthy mouth can lead to so many other problems within your bodies.
You know, it's like, oh well, it's just my teeth, you know, and well, it's more than your teeth.
I had a heart attack when I was, 40 something. I don't know that it's directly has anything to do with my mouth or not, but when I read that, I said it makes sense.
From a perspective of infection control, that's usually our first step. When we meet with a patient, if we do have an infection component, that's going to be what we tackle first. That's our focus. We want to get you healthy, and then we can take a time out and figure out where do we go from there.
80% of all adults have some form of gum disease and don't even know it. Those diagnosed with moderate to severe gum disease face surgery or stitches to treat the problem. But a less invasive option offered at Progressive Implantology and Periodontics treats patients with a laser. It's not as painful, offers a faster recovery, and often patients can be treated in just one visit.
Very busy. I manage 15 offices for Freeway Insurance of Western New York. I enjoy my work. I love my work, so I'm very busy all day long dealing, talking with people.
But Nancy Ferrari knew something was wrong when she would eat.
I was eating more on my side, not biting into anything hard, and cutting things that I normally would bite into them. Not that I almost didn't want to deal with it, but what is it going to take for me to deal with it? A tooth felt not as strong, maybe slightly weak. I had been to my regular dentist, and he had taken some x-rays, and he said, it looks like we might have some serious problems, and I'm going to refer you to a specialist. We have some concerns. We have some gum problems. It looks like issues with gum disease.
According to the CDC, half of Americans aged 30 or older have periodontal disease. That's almost 65 million people. Periodontal disease ranges from simple gum inflammation to serious disease that results in major damage to tissue and bone that support the teeth.
Any patient who has deeper pockets where our bacteria have kind of gotten underneath of our gums and are fighting with our body, starting a response that it's a war that's being waged. Typically that happens below the level that our toothbrush can reach.
You sort of take a step backward when you realize, oh my God, I have a problem. You know, I got to take care of this, and I've got to take care of this quick.
Nancy was concerned about having traditional surgery to treat the problem. She decided to go to Progressive Implantology and Periodontics for an evaluation and an alternative treatment for her gum disease.
That can be treated traditionally by pulling our gums all the way back and going down and cleaning, scraping and cleaning the area. Laser gum surgery allows us to access that area without pulling our gums all the way back.
Technology is letting us accomplish more by doing less. Long term, our objective is to preserve the teeth that people have and maintain the gum health so that we're not having that infection component affect the rest of our body.
At Progressive Implantology and Periodontics, we were one of the first practices in this region, the first practice actually, in the Rochester area to incorporate the laser gum surgery, and that was done over 10 years ago, and we have patients who have been treated by it and still to this day have healthy gums because of it. It allows us to reach the area, eradicate the disease without being as invasive.
Honestly, he calmed me down. He made me feel very comfortable. He said I had issues, but his main concern was to help me with the issues and to save my teeth and to make sure I had my teeth, and that he thought I was a good candidate for laser therapy. He wasn't pushy. He said, you know, if you want to think about it, I know you got an appointment with a specialist. So I committed right then and there. He finished doing what he had to do, and I was booked for my appointment.
Here's how it works. The laser gently passes between the gum. It's a tiny fiber optic with a thinness of 3 human hairs that vaporizes the disease. The hardened plaque is removed, the root surface cleaned. Another setting on the laser clots the blood so no sutures are needed. In addition to killing the bacteria and infection, the laser helps to stimulate new tissue to form, and bone can begin to regenerate.
We use the laser to essentially vaporize the diseased collar of tissue around each tooth. It's pretty amazing because it's using science and technology and wavelengths and all that Star Wars cool stuff to help people. When you use a scalpel, you are cutting through layers of tissue. The way that the laser works is it uses light and the reflective properties of light to literally bounce between the diseased parts of the tissue and the non-diseased parts of the tissues. We're able to literally remove the diseased collar of tissue while leaving the healthy tissue behind. Think of it as an incredibly accurate scalpel in a way, but using light. It's essentially using light as your scalpel.
The procedure can be done in one office visit or over several visits. The result, less pain, less bleeding, less infection, quicker recovery time, and back to work faster.
A doctor did both the upper and the lower procedure all at one time. It wasn't invasive at all. I felt fantastic when it was over, so fantastic that I came back to work.
What I typically hear after patients have laser gum surgery is that they don't really have any post-operative discomfort. And that's encouraging because historically, when we would do traditional gum surgery, we oftentimes would hear that it wasn't the greatest experience. So being able to preserve teeth, which is very, very important, without having patients have a lot of discomfort is wonderful.
We get very good results from it. Patients are happy, and it allows them to keep their teeth. So anybody who has traditional gum disease would be a candidate for laser surgery.
I was so excited. I told them right then at that time, I'm so happy I did this. I'm so happy I made the decision. I'm so happy that I did not delay. I'm just happy that I'm there, that I'm doing the cleaning and my teeth feel good, and I'll never take them for granted again.
That's great advice from Nancy. The frustrating part about gum disease is in its earliest stages, there are very few symptoms. That's why it's important to see your dentist for regular cleanings, to brush and to floss, and to be aware of overall changes in your mouth. It can make a difference. We've been talking a lot about the importance of healthy teeth and gums. Gums can be an overall health issue and an embarrassing problem. Gum recession can make your teeth look long and feel sensitive. But a new procedure available, progressive implantology and periodontics, moves gums back to their proper position without cutting or stitching.
Hi, how are you doing today?
Sam Nelson never minds coming into work.
It makes me smile a lot. It gives me a lot of joy. It probably falls under the category of an alternative therapy.
He uses movement to teach self-awareness and improve function for clients.
Working with people is great fun. You get to be part of their lives in a meaningful way and allow them to do what they want to do.
But Sam's own health was becoming a concern.
And they said, you've got excessive recession on the lower teeth in the front, and you really should have that taken care of and have a graft, because it'll be a real problem going forward.
One of the things that can happen over time, though, is we'll get recession around teeth. And that's just a function of, over time, having some bone loss or the tissue tending to rise up on the teeth a little bit. Historically, we would look at doing various forms of gum grafting to try and rebuild those areas.
Gum recession is a common problem affecting 4 to 14% of all adults and often goes unnoticed. But over time, an exposed root can not only look ugly, it can cause sensitivity when eating hot or cold foods. If left untreated, it can lead to tooth loss.
Why would I wait 10, 20 years and if I had an infection, I could be in really deep trouble. I looked into getting a graft. They would take a cut into my soft palate and take a chunk of that and put it down and sew it in. I heard a couple stories about how painful it was and how hard, and the problem being healing the soft palate, not the graft. So I checked into seeing whether there was something else.
Sam found out about a new less invasive procedure at Progressive Implantology and Periodontics to treat the problem. It's called pinhole surgery.
Pinhole surgery is kind of neat because it's almost like arthroscopic knee surgery. So arthroscopic knee surgery is really doing an awful lot through a very, very tiny, or a couple of tiny access points in the knee. In the same way, pinhole surgery is using just a couple of tiny little access points and a set of unique instruments and materials to deliver the care from inside the tissue versus outside the tissues.
A tiny pinhole is made in the gum. A special dental instrument passes through the opening to free the gums through gentle movement. The gums are then placed in their proper position, covering the exposed root. Collagen strips are then placed to stabilize the gums.
It means that someone can come in and have pinhole surgery completed, yet they don't have any downtime. Aside from just a tiny little circle on each side of the jaw, you really don't see any surgical activity. And it's amazing because I'm always surprised how comfortable patients are after the procedure, and the results are quite frankly very dramatic.
The procedure offers numerous benefits to the patient. It's minimally invasive since there's no grafting, incisions, or stitching. Patients like Sam experience little to no pain during and after the procedure. Treatment time is less so patients can get back to their daily activities. And there's little downtime so patients can get back to their normal eating routines faster.
Pinhole surgery is a great way to get coverage of the roots without having to go through highly invasive procedures. Covering roots is important because now we're protecting those roots from acidity in the saliva. We're going to avoid root structure loss and in some cases reduce sensitivity.
It's a major step forward because you can do a much wider area than would have been available with grafting. Get a second opinion and make sure you know what your options are.
What we do and the technology we have, we want to show people that it's successful, that it works well, because we want everyone to be doing the same things that we are to help more people.
On those rare occasions when you can get me to smile, my smile looks better, but more importantly, my gums feel healthier and are healthier. I'm very glad I did it.
Get back your confident smile. Progressive Implantology and Periodontics makes it easy with the latest technology at their 5 convenient locations in Brighton, Geneseo, Greece, Pittsford, and Webster. Have you lost confidence in your smile? Do you miss biting into a piece of steak or eating corn on the cob? If so, the team at Progressive can restore function and enhance your beautiful smile. Today, the best way to replace missing teeth is with dental implants. We're going to show you how this life-changing procedure will have you eating and smiling with confidence.
I had a bike accident with my older brother who was losing at our race and kind of knocked me off my bike, and I had one permanent tooth in my head and it got knocked out. Unfortunately, they weren't able to save the tooth. So pretty much for my whole childhood and in high school, I wore like a little partial flipper that just came in and out.
Katie App decided to get a dental implant when she was in college, but it eventually failed due to poor placement.
I bit into an apple and started wiggling, so I was immediately nervous.
Katie was referred to Progressive Implantology and Periodontics for a revision. Katie is getting married, and getting her smile just right was a priority.
The doctor that placed my first implant, he always called me Kathy. And I've never gone by Kathy, and it always just kind of rubbed me the wrong way because he didn't really even take time to get to know who I was. So it was definitely completely different when I went to Dr. Goel.
What we want to create is plans that help minimize risk to patients in the long term. If possible, we want to give people the best enjoyment from life, and that's where dental implants comes into play.
A dental implant is a small titanium replacement for the root part of your tooth. It fuses to the bone and attaches to the crown. The longer the tooth has been missing, it's likely the bone has deteriorated. If you've lost bone, like in Katie's case, a routine procedure called bone grafting can regenerate bone to ensure the success of your implant.
A dental implant is our best way currently to replace a natural tooth. So if a tooth is cracked or it has infection that it cannot be saved, that tooth comes out, and our dental implant acts as a post that replaces the root part of that tooth. So it goes into the bone and integrates in and acts as a post that then a crown can be put on. It's the best way to maintain health because we are able to floss around it. You treat it like any other tooth in your mouth.
This is my third large project like this, all of them comedy clubs. Being in the nightclub industry, you're talked to literally probably 2,000 different people a week, face to face. So it's very important that you have a nice smile.
Mark Ippolito wanted to ignore the pain he was experiencing.
Everyone said, you gotta floss every day, this and that, but kind of every other day, maybe 3 times a week with the flossing. So, lack of better care on my behalf. So they would, I had a couple of situations with some cavities that went out of control. It was a complete disaster. It was a mess. It was cracked in 2. So they tried saving the tooth, but they just couldn't. So I had to have oral surgery and the removal of the tooth, and it worked out perfect.
That's one of those things where we want to take a time out, see what the patient really wants to achieve, find out what's comfortable for them. One of the neat things about implants is that the technology is very scalable. We can do 2 implants and accomplish a great result. We can do a few more implants and accomplish a great result. And we can do a whole bunch of implants and accomplish a great result. The difference is, what is the patient's comfort zone?
Dental implants can last a lifetime, unlike bridges, partials, and dentures. Implants look natural and function like normal teeth. Treatment can take from several weeks to several months to complete, depending on the quality of bone supporting the implant. Dental implants are one of the most successful procedures in the medical dental field, with a documented success rate of over 95%.
It doesn't take a lot of implants to accomplish a really, really dramatic result. Sometimes it's as few as 2 implants on the lower to have a denture that snaps in place can make a world of difference for patients and their ability to enjoy food.
Something catches my eye, I want to take a shot at it. Because the nature comes to me, I don't have to go looking for it.
Dan McHugh has struggled with his teeth for most of his life.
The Macho Man was always like, the harder the brush, the cleaner the teeth. So I used to brush with a brush that plastic was so hard, it was like a wire brush. What I didn't know is I was brushing my gums away. But I was really looking hard for somebody that was doing non-invasive something, anything, because I knew what was coming.
Dan didn't want surgery, so he called Progressive and made an appointment with Dr. Goel.
He took more interest in my teeth than any dentist ever did. They can put the stud in, or the implant itself in, right then and there. I feel a certain relief not having had to suffer that other, say, denture road or no teeth at all.
Historically, when folks would lose teeth, we would do dentures. As a profession, we would make dentures.
Some people, a very limited percent, can function well on dentures. Most cannot. And the only time that a denture fits really, really well is immediately after it's made. They come and tell me this is a quality of life issue. It's something that they want to invest in to improve what they can eat, how they can function.
I love implants for their ability to really create a result that a patient is comfortable with, and that we don't have to kind of shoehorn a patient into just one option only.
Surgery takes things away. This guy doesn't want to take things away. He wants to keep them there.
I see a dentist regularly, and if I ever need oral surgery or anything like that, obviously I'm going to call Progressive.
So a huge, huge, huge sense of relief that it's finally done and done right and going to last a lifetime and looks great. So I couldn't be more happy.
Since implants act like your own teeth, they require the same care at home along with regular visits to your dentist. After your treatment is completed, the team at Progressive will work with your dentist to monitor your implant, teeth, and gums to make sure you stay healthy.
There's no question that a smile opens doors, but if I can tell you about one particular story that really stands out in my mind. It was a very young patient, he's about mid-30s, and he had a situation where he lost all his teeth at a fairly young age. and he had a pair of upper and lower snap dentures. And I saw him 6 months later when he came in for his routine implant check, and he was smiling ear to ear. And I said, "What's going on? What are you smiling so much for?" And he said, "I haven't been able to stop smiling since I got these." He wasn't able to smile. He's a great guy, happy guy, but he wasn't able to smile and feel confident about his smile before that. So once he had that smile, he was showing the world, and that was very exciting. And that's one of those really powerful moments where, you wonder, what drives you. That's the kind of story that drives us, and I feel that that's what progressive implantology is all about, is being able to give patients that experience.
I don't have to be embarrassed by any of this oral problem anymore, because I did have a gum problem, and I don't anymore. I've been very lucky. At 73, I still have most of my teeth, when everybody before him said they'd be gone.
I'm just happy that I'm there, that I'm doing the cleaning, and my teeth feel good, and I'll never take them for granted again.
That is a very, very rewarding process, because that's giving somebody health and function that is maintainable, and that's what we like to do.
Made me feel like I needed to take better care of myself, and that was confirmed with Suresh and the caretakers over there. Everybody put me on a plan and made sure that I knew what to do.
It really, practice after 10 years, I think, has really become an opportunity to really see people be successful and happy, and we have fun. Our patients actually do become our friends. We go through a lot together, and that's kind of right up at the beginning. And then over the years, we're making sure what we did is working.
If you have any gum problems, I've been promoting Progressive because of the results that I've had.
Make that first call. You'll talk to Barbie, and she's awesome. You'll feel right at home from the minute you pick up the phone, and you'll be really happy that you did.
My gums are good. I won't have to do it again. My gums at least are good for another 70 years.
Dr. Suresh is one of the friendliest guys you will ever meet. He's absolutely hysterical. So when you're sitting in the chair, it's like you're sitting in the chair with a friend.
Someone who hasn't felt good about their smile or their oral health, when we work through our plan, it changes their lives. They're socializing, they're smiling, they're eating foods they never thought they'd eat again, and they're healthy.
Get in for a consult. I mean, it can't hurt, and was probably the best thing I ever did for my overall dental health.
The man has an interest in his patients. Not only that, but he's excited about what he does. Christ, what more do you want?
As you can see, the team at Progressive Implantology and Periodontics are the experts in restoring function and giving you back your beautiful smile. They know how important it is to your overall health and peace of mind. Give Progressive a call and meet their team. You'll be glad you did. I'm Robin DeWind. Thanks so much for watching.